Tonight, we're learning more about how the pandemic is affecting some of this country's most important healthcare workers. We spoke with ER doctors in nearly a dozen states who say they're taking pay cuts of up to 40%. The American College of Emergency Physicians says cutting benefits and shifts could force some emergency rooms to shut down. Nikki Battiste has more on the financial fallout.
ER Dr. Leslie Simon is chair of the emergency medicine department at the Mayo Clinic and is seeing patients with COVID symptoms daily.
You go through the stages of grief when you get a pay cut, and we all did.
She and her team just took a 10% salary reduction, a consequence of the hospital's anticipated $3 billion revenue loss.
We still have student loans, we have kids to send to college, we have mortgages.
Mayo Clinic is among thousands of hospitals across the country losing money fast. Most make half or more of their revenue from elective procedures, which have been put on hold. Add to those losses at least a 30% decline in emergency room visits since the pandemic started, due to patients staying at home out of fear of contracting the coronavirus.
Do you worry that some ER rooms across the country are so inadequately staffed that lives may now be at risk?
I think it's possible. I also think a lot of them are at risk for closing.
One ER doctor who would not speak on camera told us her hours were cut by about 50% and that she is now the only ER doctor during her shifts, down from 4, making her responsible for up to 40 beds. Dr. Natasha Kay, who tested 17 patients for COVID just yesterday, agreed to speak if we didn't use her last name.
We are afraid to go into work in the ER.
And now she says also afraid to lose her job.
We feel like our jobs are more valuable now than ever. It's a little difficult to really digest what happened. It doesn't really change our attitude going into work.
Nikki Battiste, CBS News, New York.